happy 4th of July. With firework fear, we get a lot of calls this time of year for that because it seems like the 4th of July lasts all summer long now. And with some dogs have a lot of anxiety about that, and it's a noise aversion thing. There are probably frequencies of the booms and the bangs that we don't even hear that kind of really upset them. So the best thing would be not to be around the fireworks. With firework things also in that same category would be like thunderstorms and all. So if there's a lot of that will be going on, and there's maybe some other issues of anxiety, anti-anxiety medicines work really well, and Prozac, those types of things. The generic version is very effective, very safe, and not terribly expensive. And once you kind of get them on that, and if it seems like it works, it does a really good job of helping with anxiety. There are some medications. One's called Celio, which is a by-mouth medication you give 1 to 2 hours before a noise event, and it does a really good job of lowering the anxiety threshold, and they will be a lot better at ease with that when the fireworks and that kind of thing's going off. So there's a few things that can help us with that. Allergies in dogs usually manifest as a itchy skin thing, and there is a lot of that. And in the days before the really good flea and tick medication, flea allergy was the #1 cause of that. Now that's pretty well under control, but allergies for the most part are allergies that dogs and cats can manifest from where they inhale different allergens. Say, plant pollens. They can be allergic to mold, spores, those kinds of things. Even dust mites in the house, those kinds of things. So that is the #1 way dogs are allergic. So if it's not too bad, certain shampoos can kind of calm the skin down that have cooling qualities to them. Just the act of bathing in a cool water kind of thing will cool them down. Antihistamines, Benadryl is a pretty good one. There's some different schools of thoughts of opinion on that, but for the most part, that does a very good job. There are really good modern anti-itch medicines. One's called Cytopoint, the other one's called Apoquel. Those block receptors that enable dogs to itch. So if they're on those medications, most dogs will be unable to itch with that. So if they don't itch, they don't scratch, and that's pretty cool. We will use steroids judiciously in some cases. In some cases too, we will do allergy testing, and that will kind of define what we're allergic to, and then you can hyposensitize with allergy medicines, just like they did with me when I was a kid. So that's pretty cool. Other allergies that can cause some skin issues are food allergies, and there's a few different little subcategories of that. But for the most part, inhaled allergic dermatitis, atopy, that's what we see the most of, and there's lots of really good ways to manage that. Well, with dogs that, and probably puppies, I guess, that are chewing and destroying the house and just basically causing some destruction. A lot of times with that, in their defense, they're probably bored and they just need a little distraction, and they're just chewing on things because that's what dogs do. So there are a few management things that can really kind of distract them or give them something constructive to chew on. And any of the Nylabone things, if they can kind of get where they would like to have that and kind of fool around with. The Kongs are another almost indestructible thing. You can put treats in, that keeps them occupied. Also, there's these cool things called snuffle mats, and I'm sure there are other varieties of that, but they're like a small little rug that have lots of surface area. There's lots of ruffles, I guess, that treats can be kind of stored into, and they just lay on and they root and they find, and it just keeps them occupied. So really just keep them stimulated. Certainly plenty of exercise outside, and a lot of dogs, like a border collie, should never be in an apartment, so that's our fault. So those kinds of things that basically keep them physically and mentally stimulated should really kind of help with them destroying our house. Well, probably the most common pet owner mistake would be letting vaccinations lapse, and I guess there would be a lot of potential mistakes, I guess, that we would not want to do, but that would be most likely number one. Rabies, certainly to protect the pets and the families and all that. Rabies is obviously a terrible disease, very easily prevented with vaccines. If there's a rabid animal around and we're not vaccinated, it sets off a protocol of quarantine and all that, and sometimes even euthanasia if dogs are not vaccinated or cats. So whereas if they're vaccinated, it's a lot different outcome. And then certainly the potential of having the disease, that's something we don't want to mistakenly forget to do. Parvo and young puppies, they need to be vaccinated at, sometimes breeders will start at 6 weeks, and it needs to be boosted until they're typically 16 weeks of age. Rottweilers, Dobermans have protocols that can go up to 22 weeks of age, but Parvo is just a very deadly disease, and some folks kind of hear that they don't need vaccinated till they're 6 months. They need to be vaccinated at probably 6 weeks, and then boosted every 3 to 4 weeks as the vet requires. So there's other diseases that vaccines protect against: distemper, lepto, a few others. In our area, we see a ton of Lyme disease, and any unvaccinated dog that comes in limping, not feeling good, we do a Lyme's test on them, and probably 50% of the time those dogs are positive. And so, it can be a devastating disease, and that vaccine works really well to prevent that. So the biggest thing that owners mistakenly do is and it's busy and all that, but is we just can't let those vaccines lapse.